Q&A. But before I do, I just ask you all, if you don't mind, just to read this disclaimer. So I'm just going to keep quiet just for a minute or so. So if you wouldn't mind having a look at this slide. Okay, I think we can move on from there then, and I think we can move to our panel. And we're very fortunate to have a really clever group of individuals here this evening who are going to answer a number of the questions you have. And we have lots of questions, but keep them coming. If we don't answer them tonight, and we are running out of time, but if we don't answer them tonight, we will answer them and as quickly as we can. And keep telling us what events you would like, what consumer events would you like in the future, and what sort of topics would you like us to focus on, and we can look after that as well. So in addition to the 5 speakers that you have already met, I'd like to add 3 other panel members. Associate Professor Haryana Dhillon, who's Director of the Center for Medical Psychology and Evidence-Based Decision Making, where she co-leads the Cancer Survivorship Research Group. She has expertise in clinical trial and intervention development, working closely with Australia's Psycho-Oncology Cooperative Research Group. During 2020, she's been lucky enough to spend quite a bit of time COVID safe and working remotely from the Liverpool Plains in northwest New South Wales, attempting to train her dog Reefer to leave echidnas alone. Now, if you could dedicate just at least 2 minutes to how you do that with your dog, Haryana, that would be very helpful. Dr. Zakir Hussain is a demographer and a health sociologist. She's senior lecturer and course director of Bachelor of Health Sciences in the Faculty of Medicine and Health at the University of Sydney, as well as a member of the academic board of the university. Dr. Hussain is a recipient of international awards, including AusAid and Winrock International. Her research focuses on breast cancer awareness, quality of life of breast cancer survivors, reproductive health, migrant and refugee women, and women from resource-limited countries. And the final panel member, but certainly not least, is Dr. Sussan Coulson, who's a clinical and academic physiotherapist whose main area of interest is in assessment and treatment of facial nerve disorders. Her doctoral master's research at the University of Sydney, where she currently holds an academic position. For more than 25 years, her clinical and research work has focused on assessment and treatment of facial nerve disorders, including 3D motion analysis, reliability of grading systems, telemedicine reviews, and interventional studies. She is a founding member of the multidisciplinary team of practitioners at the Sydney Facial Nerve Clinic. Okay, so if all the panel are ready, I have a series of questions that you have already forwarded through to us, and thank you all of you for doing that. But I'll kick off with the first question. This is directed towards Robyn and Catherine. How can we address some of the workplace challenges facing people living with advanced cancer? For example, a better understanding of the varied disease trajectories of those with advanced cancer, and reduce the discrimination that some face in terms of promotion, opportunities for advancement, and so on. So Catherine and Robyn, if you'd like to have a go at that one.
I'll go first if you like. I guess from a medical perspective, each case, it's important to assess each case individually, because everybody has different cancers, different responses to treatment, different side effects, different work, different psychosocial issues. So we look at it case by case, but also really trying to work out what are the inherent requirements of the person's job, and matching that with their functional capacity. And you know, it may be particularly important to consider, is there a safety critical aspect to the job, and you know, how does the person's functional capacity impact on that, either temporarily or permanently. But yeah, basically case by case basis.
I would absolutely agree with that, and it comes back to exactly looking at the job. And I talked about what can the person do. So we've heard about having return to work plans. We would want to have some guidance from medical practitioners as well to support the team member in how we do that, to set them up for success. And I think that's really important. And then how long are the arrangements needing to be in place? So it might be, what's the plan for the next month and then 2 months? So regular reviews would be really important to see how it's going, and really being able to have that open communication along the way is really important, because sometimes whilst you have good intentions, it doesn't go according to plan. So we have to be able to then deal and talk about those situations, or you might have to change your plan as well.
And this is for you, Robyn. I hope it's a legal question which you might be able to help with. My employer manager knows I have cancer and I'm on reduced hours due to cancer. I'm usually full-time. I come back to work. I came back to my position, and my employer wants me to do my full-time position plus another position on top of my usual position when I got full-time. This seems unfair and discriminatory. Are there any policies or laws around this?
Look, I think when it comes to policies, each business will have its own policies. So it's really hard to talk about specific policies. I mean, you know, we do, but every business is different. There is absolutely legislation around, I suppose, disability discrimination, equal opportunity. There's things around fair work in terms of that. So I think it also comes back to what the team members' contract of employment would say as well, in terms of, you know, and their position description. But there are legal frameworks, and I would say in that situation, I would try to talk to the HR person if I felt I couldn't talk to my manager. It's, you know, if I feel that I'm being asked to do things over and above or unreasonable or things I can't do, talk to your HR person. Or we've heard tonight that there are legal resources available to seek some external assistance, and sometimes that's good to have some other guidance in terms of then how you can bring that and try to resolve it in the workplace.
Okay, thank you. Thank you, Robyn. And certainly all those resources and links that you saw earlier will be made available after this. So please feel free to use those. If I can shift the flavour of the questioning now to you, Liz and Jasmine, what changes to my lifestyle should I do after finishing chemotherapy? How should I deal with work-related stress?
I can start, Jazz, if you're happy with that. It's obviously a very broad question to answer, not knowing what your lifestyle was like before. But increasing, as Jazz talked about, increasing, you know, the daily activity and weekly activity that you're getting is usually helpful and needed after periods of chemotherapy where you might not have been quite so active. And physical activity is also excellent at helping manage stressors and stressors in life. So finding the types of activity that you enjoy and that fit in with your life and routine and that are not causing other things to become worse, such as fatigue or pain or movement restrictions, is really sort of open to you and what's working for you. But this is where finding an exercise physiologist or a physiotherapist to work with can also be helpful in making sure you're returning to physical activity safely.
Yeah, thanks, Liz. I don't really have much to add to that. I think that exercise and physical activity, as Liz has said, has been demonstrated to have a lot of psychological benefits. So around stress, also around management of anxiety and depression as well. So the benefits in that aspect are quite far-reaching. I think returning to or commencing post-chemotherapy can be challenging. So I would advise getting some advice and being kind to yourself as well, I think, and starting slow. I think there's not a harsher period during treatment often than chemotherapy itself. So using some of those strategies and tips and just allowing yourself to take it day by day and allowing yourself to account for those days where you're not feeling as well as you were the previous day, lowering your expectations of what you try to achieve on those days, I think is important.
Thank you both. And I think what was very reassuring, Jasmine, from your talk was that, you know, anyone who wants, any of us who want to do exercise can do this in any space. You know, we don't need to buy expensive equipment and dedicate huge amount of time and change your life hugely to do this exercise. You can actually do it over a short period of time every day. And if you've got a wall, you can do it. Yeah. A question for Haryana and Joe. My main issue has been concentration. I'm almost 2 years post-treatment and on tamoxifen. Any suggestions, research on this post the first 12 months?
You can start, Haryana.
Sure. So I guess, you know, this is not an uncommon problem that people describe, and we certainly have seen changes that can be long lasting in some people. And I guess the first thing that I would do in talking to people about their experience with concentration is to try and understand actually what is the problem, for what's causing the problem with the concentration. So is this difficulty concentrating in noisy environments? Is it a difficulty concentrating and processing information while reading? Is it likely to be more of a cognitive fatigue problem? Because I think the issues are slightly different. You know, the solutions to those things, or the way that you would approach them, are slightly different. But a general approach really is to just is to sort of, as other speakers have kind of highlighted, is really to try and work out when your concentration is at its peak during the day, and schedule your tasks and the activities that require a lot of concentration around that. And also then to, as Jasmine was speaking about, increase your physical activity and exercise, because all of those things combined will start to help and impact on your concentration levels. Joe, do you want to add anything?
I guess we didn't get time to talk about it, but there are some, cognitive rehabilitation trials that have been run, and they are external to work. And so whilst you can register to try and do some of those things, I know for a lot of people that are working, it's hard trying to fit everything in. So the strategies that we've presented today are very much workplace based, and trying to think about how you use your work tasks as a form of rehabilitation, really just slowly grading that, but working with your employer to do it. But there are some external trials, and I guess we can post links to that later on as well. There are always different options as well.
Okay, thank you both. Another question for you, Joe, with Liz and Sue is, I am 5 years post-radiation therapy and still having difficulties coping with fatigue. I seem to be unable to achieve as much in my day. Any suggestions?
Sue, did you want to answer? Did you want to go first?
I think the talks that were given this evening, one of the key things that came out of the talks about exercise were very much about identifying that time of day that works best for you. And I think that's with any form of exercise, cancer or not, that's actually the time that we're likely to do exercise beyond that first week and beyond that first 2 weeks. Is really increasing that compliance, increasing that regularity of the exercise. We know it's important, and many people have spoken to that tonight, but actually recognizing that exercise will help with fatigue, and identifying the time of day that it's more likely that you will continue to do, and then build on that exercise program to address that. Liz?
The only other thing I would add is to communicate with your healthcare team to make sure you undergo an assessment, blood tests and other tests that they could advise you on to see if there's anything else that could be looked at to help manage that fatigue aside from exercise as well.
I just think connecting and knowing now today, we've talked about, resources that an occupational physician can help you as well. So knowing that those options are there, speaking to your GP and saying, I'm having trouble at work, this is what's causing that. And knowing that there's a link there and a referral opportunity that could help your the process as well, by having someone to help you along, travel that journey and explore some of that, the impact on work as well can be helpful.
Just talking about the time of day, and I saw this referred to in the talks earlier. is there generally a specific time of day that suits most people? Because we know we've got diurnal rhythms, for example, and we know how these cycles with reasonable precision for most people during the day. Is there a specific time that suits individuals better than others, or is it just for individuals to find what suits them best?
My flippant comment would really be that I don't think there is a time that suits everyone, and the time at which you will do the activity is the best time to do it.
And I'd also add that shift work is difficult for probably everybody one way or another.
Yep,
so if you're doing night shift, that's going to be hard.
Mm.
Mm. And I'd just, the final thing I'd add to that is, although that we can identify a certain time on a certain week, then it may not be that that's what's happening the following week. So it's actually to be responsive and listen to what's working for you in a particular time frame, and really maximise that time that you're feeling as good as you can feel to capitalise on that.
Mm.
Thank you all. One for you, Liz, particularly around lymphedema. I have lymphedema of the left leg following lymph node dissection 11 months ago. Given I sit down all day, is there something I should be doing to better manage this other than wearing a stocking and regular drainage massage?
Yeah, it's a very tricky issue with leg lymphedema and roles that involve a lot of sitting. A lot of people find that if they can get a position, sort of a stool or something under their table or desk wherever they're working, where they're elevating their leg, that can, not for the whole day, but for periods of the day, that can provide some improvement in comfort and prevent worsening swelling. I think regularly changing positions, so standing, going for short walks regularly also is very useful, and just making sure that your work setup is as ergonomically useful or as appropriate as possible to prevent any areas where you've got excessive bending or discomfort of your legs, or particularly around the groin or abdomen, to avoid putting any any pressure, on the lymphatic system. And some people will also find that changing how they manage it at night, so night wraps or compression pumps in the evening, can make the management less, need to be less of a focus during the day. But the compression stockings, changing work patterns and habits a little bit, is usually the go-to to start off with.
Thank you very much, Liz. Now a question for Zakia and Catherine. What tools or strategies would you recommend for a cancer patient whose sleep is deprived due to their medication side effects, and they are fatigued and lack the cognitive function required to return to work? They have tried various tools without success and were advised by their doctor that it is unfortunately simply a side effect of the medication.
I guess I'll go first. Yeah, I guess the first thing is to speak to their doctor to make sure that that they can optimize the treatment and minimize the side effects as much as they can, with changing the doses or the types of medication, making sure that there are no underlying other reversible causes of the fatigue that could be treated. For example, anemia or nausea, depression, and optimizing the treatment of all those underlying things. And then I guess once they and the doctor are happy that they've all those things, then looking at the job and talking to the workplace about adjusting the role temporarily or permanently to allow them to get back to work. Maybe a graded return to work can sometimes help as well, because the best place to build up work stamina is actually at work. Everywhere else you're just simulating it, really. So if they can find some way to do a graded return to work and see how it goes, that potentially could be an option. And I think also, as Robyn said, regular review is really important, because things change over time. People get better or they get worse, and so having some plan of, we're going to try this for a set time and then we're going to review, is really important.
Thank you.
Thank you. Thanks, Kat. Just wanted to add some more points in here. For example, with the cancer treatment, a lot of people experience sleeping deprivation and sleeping problems. And that can cause some of the issues, for example, cognitive issues, as well as return to work, feeling fatigue and other things. So there are some strategies that can be used. What we have discussed so far can be like looking into the exercise, but other thing, for example, is stimulus control, relaxation, and also relaxation therapy. When you say stimulus control, there could be something like de-associating with the bedroom and beds. So only bedroom can be used for sleep, not for any other reasons. That can help improve sleeping. And if there is a continuous sleeping problem, so need to work out like sleeping time and wake up and going to bed time fixed, so it's not changing every now and then. And also relaxation therapy. There are many different relaxation therapy that can be used. But some of the relaxation therapy could be, for example, muscle relaxation, and Jasmine mentioned some of the exercises. Also thinking about like different things that can help to relax, warm milk, warm glass of milk, and also some chamomile, tea, and also something to do with not eating hot food before going to bed, not eating, drinking alcohol before going to bed, that sort of things. Other thing could be cognitive therapy. We have discussed so much about the cognitive therapy and some of those. And I would like to say, like, sleep hygiene is also a very good, important thing to remember. And that sleep hygiene could be looking at what we should be doing, what are the regular things that we should be doing, what are the things that should be done before going to bed, and also need to use the bed just for sleeping, and sleeping environment, making sure like the room is comfortable and calm and dark, and so it is the environment is very important. So sleep is very important in terms of a lot of side effects can disturb sleep, and then if sleeping can be improved, that can improve the cognitive aspect, as well as improve the going into workplace, not fatigue all the time. So I think that part I was thinking like would be an important thing to consider.
Okay, thank you, Zakia, and thank you, Catherine. I know we're out of time. I'm going to ask one last quick question, which is pretty topical, I think, and for you, Robyn and Catherine, how should I cope with COVID-19 when going back to work? I'm anxious about my immunity, especially that I work in a customer service. I finished my chemo almost 4 months ago. So quick answer, if possible, to possibly a difficult question.
Yeah. I think first of all, it's important to talk to the doctor or specialist about what they think the risk is, and are there any particular adjustments they might suggest. For example, do they think this person's high risk and therefore should look at temporarily doing a non-customer service role, and then going to the employer with those recommendations to see what they can accommodate. Because I know in some employers they are doing that, assessing high risk workers who may be at risk of higher risk of severe COVID disease, and then the doctor gives advice about what they should or shouldn't avoid, and then the employer looks at what they can accommodate.
Yeah, so we would absolutely go by the doctor's advice, and we've absolutely been in that situation as we've had to work through COVID over the last few months. And I think, we've seen that there's this group of what we would say are vulnerable workers. So some have still not been able to come into the workplace based on their doctor's advice, but that's what we would make those decisions on. Or if you can accommodate it in a different way, we would look at it. But the medical advice for us is important to understand, once again, what we can or can't do in that situation. It's not easy.
All right.
Can I add one more point? I think it is important. Very quickly, it is important that cancer survivors, they should disclose their immunity system and whether they're at risk or not to their employer, and so that the employer is aware about that, and take necessary steps. And that's really important to disclose their situation.
Okay, thank you, Zakia. Okay, well, I think we need to wrap up. It's a real shame. I'm having a high level of frustration because I've got lots and lots of really good questions that you have given us, and we will answer all of these. But I know that now we've gone over time, so I better stop there.